Well, hey guys, this is Scott, and thanks so much for joining our webinar today on the real world examples of healthcare mobile threats. I'm going to go through some threat data that we have collected from one of our healthcare customers. It's completely anonymous, so you won't be able to identify who the customer is. And of course, we want to make sure and maintain their privacy, because privacy is actually one of the main concerns that people have when they're managing mobile devices. They're looking at threats, they're looking at profiles and apps and things like this. So we want to make sure, and especially since our HIPAA compliance, right? So we want to make sure and maintain privacy. But what I would like to do is offer, a Q&A time at the end. If you do have a question, just type it in the Q&A window and it'll queue it up for me to cover at the end. If I don't get to your question, I've got my email address on the end of the video. And I'll also have some anticipated questions, because the same ones come up, and they come up all the time. But essentially, I want to talk about, mobile and healthcare. If you ask me, healthcare was always mobile. We used to have on-call doctors, house visits. The doctors are very mobile, but what wasn't was their data. And so now all of the healthcare data and our patient data is coming with them on their devices. And I've got a couple of different sources here from information technology and physicianspractice.com on how healthcare's, all the CIOs, they're embracing mobile, right? Because it just increases patient care. Everybody is more efficient with all the mobile devices, and 65% of healthcare CIOs are bringing mobile elements into their healthcare clinics, into their hospitals, into their systems. And then almost half of all healthcare CISOs, they already use mobile applications, right? So if we're using all these mobile applications, we have to secure the devices that we all carry, the clinicians carry, the doctors carry, and then we also have to secure our apps, right? So we're not all app developers. We as Imperium are app developers, but most hospitals don't have development teams on staff, so they have to outsource that. So you have to make sure that your mobile apps are constructed in a very secure and private manner. And then a 2018 survey of physicians showed 75% use mobile health solutions in their practice on a weekly basis. I would argue that's probably daily, right? I went to the doctor. There's never an empty waiting room, right? So these places are packed. And how they use it, obviously they're looking at videos on how to perform surgeries, or maybe on clinical issues, secure communications with providers. Think about a prescription transfer process even. I did one of those the other day. It was pretty painful because it was on paper. I thought, why isn't this on a mobile device? And then how are we looking to expand? Really, we want to look at disparate teams. We want to make sure and communicate with those teams. Those teams are going to need the most up-to-date clinical documentation, patient data. All of this goes on an endpoint that may or may not be secured, right? These are mobile devices, because they pose an interesting security and compliance challenge. If you think about an endpoint, we argue that mobile is the most important endpoint, because 56% of all devices online right now are iPhones, Android phones, and tablets, right? And if you look at the security challenges, healthcare is one of the industries where you must you have to identify if you've been breached. So there's a lot of data out there, and 25% of all attacks occur more than any other industry in the healthcare industry. And then one study, 48% of healthcare organizations reported a breach just in the past year. And with more and more data being pushed out to those mobile endpoints, you're going to see this more and more. So we really need to secure these endpoints and all the data they have and the access that they have. So that's one key point, is to make sure that you really understand the amount of access. Really, in a BYOD environment, in an unmanaged device, they do have access to your networks, to your applications, to patient data, all types of dangerous things that you may or may not have data on how to manage. So if we think that mobile devices are pervasive, I just want to show you a little example of, from the past 2 years. In October of 2016 is when mobile devices, just by themselves, not counting tablets, surpassed the market share of desktop PCs. And they're not going away. Everything is going to mobile. If you want to make sure and create an argument for where you should be spending your time and your security budgets, I would argue that mobile devices are the place to be because, one, there's more than any other endpoint, and then two, it is a very large timeshare of where we spend our time. And especially in terms of compliance. So if we have all of this mobile data on our devices that may or may not be secured, okay, it's secured on the device, data at rest is encrypted, but a human cannot read encrypted data. So if you can see the data on the screen, so can someone else that is controlling your device or has access to it through some remote access Trojan or an advanced app attack. But HIPAA section 164.308, you guys are all familiar with these. You have to have protection against malicious software. What type of apps are on the devices. You have to have a log of all the security incidents and have policies to recover when an incident occurs. So if an incident occurs on a mobile device, you really have to have the logs and the implementation specifications to, one, identify that attack. Two, you have to respond and remediate through a policy, and then you have to report this. So if you don't have something on, your most primary endpoint, then you really need to look into something that we're going to talk about here a little bit later. So what are attackers seeking? Well, mobile devices have a lot of information on them, but more importantly, it's the access. So hackers or attackers are looking for credentials, and this may or not be your credential, depending on who you are. If you're an administrator, or if you're a security professional, you pretty much have pretty good security hygiene on changing your passwords and things like this, but not all users do. My wife uses the same password for everything. I can't believe I just said that on the webinar, but she does. And she always remembers it. And I have thousands of passwords and I change them all the time, because the nature of the business. So the credentials and then data. So the access to the data that a mobile device has is very, very vast. It does have data on it, but more importantly has access to other systems that contain data. And then weaponization. How do you weaponize a mobile device? Say, for instance, I want to put some type of app or a profile or some type of unmanaged piece of software on the device to actually weaponize it. And I'd weaponize it outside of a network. I'd bring it inside the network. You basically brought the hacker inside. He gains access. He's scanning open ports. He's looking for other ways to get in, because the mobile device is being used in an attack is the attack, right? So you need to make sure and remember that the mobile device is being used as a part of the attack. It's not the end game. And so what are the real threats? The sole perspective and persistent foothold is really what they're after. I want to have a device that I can control whenever I want, and I want to have you bring that into the network. That's very, very dangerous. Just yesterday we talked about an attack method where someone was able to actually steal files from an internal file server behind the firewall by weaponizing a mobile device. And they did this through a game. They had someone download a game. The game then scanned the network, and they looked at open ports on the network, and they went laterally through the attack to steal data. Very, very dangerous. And then how those attacks occur, Well, primarily they're going to be over the network. So that is how data gets to and from these devices, is over the network. So if you're not looking at network attacks, then you need to be looking at what type of connections those devices are making, who's trying to connect to you, who's trying to spoof your network, or who's trying to trick your users. Because users are, they're a big threat, right? So we look at phishing and malicious apps. Malicious apps are one of the most popular conversations, but honestly, it's the least popular attack method because it's very, very difficult. It's like casting a wide net and looking for the person that you are, trying to attack. But, phishing over the network is much more targeted, and especially with all the data breaches that have happened through the past, 3 or 4 years, many of us are very easy to fingerprint. And the phishing emails are getting really, really sophisticated. They're very targeted. They're just like ads that we see online. These phishing emails can trick us very, very easily. And on a small screen, like a mobile device, you'll click on it. So it's very, very dangerous. So now I'm going to talk about what happened on a random sample of 1,200 devices earlier this year at one of our healthcare customers. And then I do have some anticipated questions from the data set. So if you do have any more questions, please type them in the Q&A window and we'll get to those at the end. So we look at the devices in 2 different ways. We look at the static risk, which we're calling device risk. So this is a risk that the device would have if it's just in your hand, in your pocket, sitting on a table, okay? 95% of the devices in this customer were running vulnerable operating systems. So if you are not updating your operating system, you are basically violating the first rule, right? Keep your systems updated. 95% of these devices were not. And normally what we see in enterprise devices, why they don't update, is because they have proprietary applications on their devices, and they can't update their proprietary applications fast enough. So they lag, right? And so what we really look at is, are you on the most current operating system or 2 back, right? So if you're, in this case, these were all iOS devices. And as most of our customers are, they hadn't updated to the latest operating system. So again, you can look that up, and there's all types of CVEs that are listed where you remain vulnerable. And then 5% of their devices had no device PIN, which is interesting, right? Because it comes out of the box that you need a PIN code. The latest iOS operating systems, you can do any number of PIN numbers, 4, 6, 12, 24. You can really get up there in terms of just securing your device. But that is interesting that these enterprise devices had no device PIN. And then, connecting to networks, 35% of these devices were actually connecting to unsecured Wi-Fi. So this wasn't unsecured Wi-Fi in the office or at the hospital or in the clinic. This is anywhere, right? So these devices go in and out of the facility. So if they're connecting to an unsecured Wi-Fi that doesn't require a password, that's just a level of risk that you may or may not want to take on with your users. But at least, these guys have, policies to identify it. So if they are in an unprotected Wi-Fi network and something else happens, they have policies to recover. Another thing that we see is malicious profiles. So if you go into your iOS device and you go into the settings, and you can find these management profiles. If you have an MDM, it'll list your MDM back there. On my device, I have an MDM, so it lists the MDM provider back there that manages some of the settings, the Wi-Fi settings and things like this. So we do see these malicious profiles, and they're profiles that the users in the management team and the security team, they don't even know that they're there. So if you're not looking, you're not going to find them. So what is a malicious profile? So a malicious profile it's an XML file, and it manages settings and Wi-Fi settings, VPN settings, a lot of different settings back in the back end that allows someone else to use your phone. So if you have if you have one of these profiles that you did not install on there, quite possibly this is someone trying to remain persistent on your own device. And since they're not apps, many people don't look at them. They look for malicious applications, but they don't really look for the malicious profiles. So they're, the distribution of these profiles and the management or, compliance policies, they don't exist because you can't find them, right? So you need a way to find them. So again, so somebody may ask, how does a malicious profile get on your device? So we had a user download a game, and the game actually wanted to install an installation helper. Think about like a cheat sheet or something like that. And it actually installed this another app that actually ported out to third-party app stores. So again, the user was just trying to download a legitimate game. It came with the helper. The helper had another profile, because then it asked for different access to his device, and he gave it access because he thought he was doing the right thing. He even paid for the game, which is interesting, right? So what happened is he was running the Zips product that we'll talk about a little bit later, and his security team was actually notified that, hey, you got this management profile on there. You've got something going on with your device. We're going to need to lock you down and investigate further. So that was static threats. And what we're going to do now is talk about active threats. So these are threats that would happen if a user was using his device. So again, we had a little over 1,200 devices. 20% of these actually recorded a threat. Okay, so 1 out of 5 devices, if you think about who's in your office, if you're in an office with 5 people, one of you was attacked during this time period. But of all of those attacked, 98% were network threats. Okay, so like when we were talking earlier, that the primary mechanism to deliver threats to the device is over the network. So since we're actually looking for network threats, we can identify those threats that are happening in real time and report those to the security team. And then on the right, we'll talk about how those network threats actually broke down. So if you look at the network threats, almost half of them were fake SSL certificates. So these are fake certs that get delivered to the device, possibly trying to trick the user into submitting some data to someone else. In terms of ARP man in the middle attacks and minimum attacks, again, it's about 1/3 of all the network attacks. And the network handoffs, that's when your device actually moves from one piece of equipment to the other. That we actually record those, but most customers don't actually submit those as a threat that would require action, right? They just kind of monitor and make sure that anything is going on. So not a high level threat, but again, we actually take a log of it for compliance reasons. And then one of the most popular questions, how can I generate this data? So we as Imperium, we provide a machine learning detection technology called Z9. And essentially, Z9 works just like an echocardiogram does on your heart. You can go to the hospital, it scans your heart for issues. We're doing the same thing with mobile devices. So if we can provide the technology to you in terms of getting the technology on your app, either through an MDM or on your app through, or on your device through an app, then we can deliver the technology. The technology will actually record those hiccups in your device, just like an EKG. So how do you get it onto the device? So first way is if you have an MDM, you can push a Zips app to all of your users through your MDM, or it can be provided through our Zimperium console. Essentially, you just have to get the app on the device. And what the app does once it's activated is it looks at the operating system and it makes sure that everything is okay. If not, it reports it to the security team. And if you have an app that you build, we actually do offer a software development kit called ZApp. And what ZApp does is an SDK that you can actually place inside your app. So whoever has your app will get the technology once you update it. It's very popular in healthcare and banking applications since so many proprietary applications are being built. And then from an overall perspective, what does it look like? So on the left, we've got devices, and they are actually reporting back all of the detections and policies, right, back and forth to a management console. The management console can be placed pretty much anywhere you'd like. It can be behind your firewall. It can be in any cloud provider. And then those consoles can actually be managed, in conjunction with an MDM or in standalone. Whichever MDM you have, you can manage your users there, and then just have us port the technology either through the app or through the SDK to your users. And then your security team, basically, they can just manage their own systems with their own SIM systems or ITSM systems, whatever you may have. Their process doesn't change, right? But what does change is the number of procedures that they can respond to, because right now they can't really respond to a mobile threat because they don't have the data, but yet they have like the policies and the procedures to respond and lock down threats. Then they just respond to mobile threats. So their process doesn't change. They just get more data feeds and they become more intelligent of what's happening on the mobile endpoint. And that's important because we talked earlier, 56% of devices online right now are mobile or tablets. So with that, I will take questions if you have any questions. And if not, if you don't have a question now, what we can do is you can go back to the website. Please download any papers, any research material that you would like. If I didn't answer your question or you want to ask a private question, I can respond back to you today. My email address is scott@zimperium.com. I'd be glad to hear from you and answer any questions you have on Zips, ZApp, healthcare, compliance, what have you. So with that, I will bid you a good day. Thank you so much for joining, and have a great day.